Hello, everybody, and welcome to another episode of the Healthcare Education Transformation Podcast. I'm your host, Dr. F. Scott Field, and I've got with me today a very special guest who never ceases to amaze me. Every time I talk to this guy, I feel smarter. Dr. Natty Bandasak. Natty, how are you, man?
I'm good, man. Thank you for the compliment. And again, I have to return the compliment to you as well. Love talking to you. And I think, again, I get wiser every time we talk.
Yeah, I love it. I love it. So now I'm ready to sit down and actually get to interview you, which is fun. Tell us a little bit about your academic journey and how it's led you to where you're at today.
Okay, yeah. So moved here from Thailand when I was 12 and went to, small high school in Nyack, New York. And then from there, just didn't know what I wanted to do. My parents were working like three jobs during that time, like most immigrants' parents do. And, didn't really have much support in academic of like where I wanted to go. So just kind of like paved my own ways. Ended up in community college for 2 years. Then after that, really got into fitness. And I was like, oh, you know what? I want to do something in fitness. And, I had high school teammates that went to University of Maryland and he was studying kinesiology. I was like, oh, that sounds really cool. I took a visit to go see him, loved the environment, went to my first college game day there. It was awesome. I was like, all right, this is where I need to be for the next 2 years. So, worked throughout my community college time, saved some money, take out some loans, and then got into University of Maryland. And I spent 2 years there getting my kinesiology degree. During that time, that's when I really got into, the sport performance world, where I was able to shadow one of my professor who was the team chiropractor for the University of Maryland football team. And then from there, he encouraged me to get my CSCS and then study through all of that. And then as I finished school, I was like, oh, I wanted to open a gym. Like that was a big thing for me. I was like, fitness, like transform my life. I got tons of confidence from it and be able to help people get healthy was huge. But while I was doing that, I came across some of my clients who ended up getting hurt. And I just kind of didn't know what to do. So I just kind of like, okay, all right, we'll take it easy. We'll digress a little bit. You go see your PT, and then they'll go see some PT, and they will come back. They'll get like minimal result. I'm like, huh, okay. I don't know why they're not getting better. And then every time I send them to a doctor, they're like, okay, well, they got to get some sort of shots, or they have to rest for like 6 weeks. I'm like, well, if you rest for 2 days on bed rest, you lose 7 to 10 pounds of muscle. I'm like, well, that's kind of counterintuitive. So that's when I started like diving in more like, okay, is there something else out there that I can be doing? Um, Fortunately and unfortunately, I injured my lower back during that time where I couldn't walk for like 2 weeks. I was having pain standing up every time, just shooting down, like severe sciatic nerve, um, you know, disc herniation from like L3 to L5. And at that point, I was like losing hope really fast because fitness was like my number one thing that I like to do. Started doing some PTs at a friend of a friend that I know, and then he's helped me out a lot. And then from there, I dove into more of a Kelly Starrett kind of world during that time. Actually, changing my whole mindset of how PT should be, where it's more like movement based rather than just TheraBands, 3 sets of 5, doing small little detail things. In combination of going to PT and doing the Kelly Starrett mobility watch stuff during that time, I rehabbed myself back within 2 weeks. I was under the bar again, squatting, deadlifting, competing weightlifting. I'm like, this is really cool. Like to be able to get myself out of pain and go back to training, this is huge. Then I realized, hey, maybe this is the better path for me to go forward. Let's look into PT school, see this is an option for me. Because I know how to get people stronger faster, keep them accountable for them to lose weight. And I can help them when they have pain problems. I can get them back on track to where they need to be. So lo and behold, I applied to one PT school, which is like 10 minutes down the road from where I live, which is Dominican College at a time in Orangeburg, New York. It's a weekend program. Now they're doing so well, they're now Dominican University. And I love that format so much. I would go to school Friday, Saturday, Sunday for 3 years straight. We have some breaks then and there. But during that time, I was able to still work as a personal trainer and a strength coach. So whatever I was learning in PT school, I was able to apply in a real world setting. So, you and I know that when you're in PT school, you have to do 3 to 4 clinical rotation, right? But for me, I was doing rotation and also working in a real world setting, knowing how to communicate, knowing how to cue, knowing how to, like prescribe exercises. So that just like my brain just changed to like a different path. And from that point on, I'm just like, this is what I would love to do, for the time that God gave me to be on this earth. I just keep helping people. And then, 2016, I graduated PT school. I got my first job. I was working in a typical setting, right? Seeing like 3 to 4 patients an hour. Around like a year into that setting, I started to get burned out because all the population I was seeing was very active, and active people require more time and attention, and I want to do more for them. And because of that, I was burning myself out where I was showing up an hour earlier for work, but then staying an hour later, but then still have to come home, do all my documentation, cook dinner, go to bed at 11 or 12, do it all over again nonstop. And at that point, I was like, okay, what's the next move? And then that led down to another path of me saying, well, when I was a personal trainer, I was able to see my patient for an hour or 45 minutes. I was able to get a lot of stuff done. People was, they value what I had to offer. So there's a need there, right? So I was like, why don't I just try to see if I can do some sort of a hybrid model where it's a strength conditioning personal trainer, but with combination of physical therapy. And then that way I get to work with my ideal clients and then give them the outcome that they want. And I also feel fulfilled at the same time. So that's 2018 that led me down the path of starting my own clinic, which is Myokinetics. We're 8 years in already, which has been a blessing, incredible journey. We helped countless of athletes, like competitive adults, and just every single day we get to do good work and then change lives. So that's a short story of my whole journey.
Yeah, man, there's so much to unpack there, and I love it. And I want to do a little deeper dive here because it's interesting the way that your journey started and some of the mindset shifts that you had to go through on this journey. I love the fact that you got into Kelly Starrett's stuff early and you kind of adapted and realized that, hey, yes, people need help getting out of pain and getting stronger and living better active lives, but they also have to kind of take responsibility for their own health and activity, and they really have to do things that I know how to help them with, but I also have to put the onus on them and they've got to do the work, right? And so, like you said, being more active was a key component of your journey, whether it was through sports or active community of patients. And that really shaped your path. And unfortunately, and fortunately, like you said, that a lot of times goes to that burnout path sometimes, right? If you're working at a typical 9 to 5 and it's, 30 patients a day or something, that'll get you to burnout pretty quick, right? So then you had that next mindset shift of like, all right, well, what's the next move to do it the way I think it could be done better based on a lot of the stuff I've learned over the years when it comes to staying active. So I love the journey, but the bigger picture again for me is just the mindset shifts that you had to go through while working, while studying, while doing all the things that are not easy and yet still coming out on top, right? So talk me through a little bit of that mindset shift stuff that you had to work through from student to now business owner.
Yeah, I think it's an evolution that we all have to go through. Just like it when I was injured, right? You have an identity as an athlete, so now you're an injured athlete, and now you're trying to fight your way back to become an athlete once again. It's as simple as you're looking at a caterpillar who turned into a cocoon, and then a cocoon turned into a butterfly, right? I think us as human being, we have to keep aiming for some sort of transformation, right? And I think my favorite quote from Friedrich Nietzsche would be, I'm sorry, not Friedrich Nietzsche, it would be Viktor Frankl, is that, any man who has the why can bear almost any how. And that's to me is understanding why I'm doing it for, what I'm doing it for, and then figure out the how. That's really the key, because the how will change every single day, right? If you and I were to drive to our place of work to home, the destination is the goal, but how we get there depend on traffic, what's going on, right? If you have to pick up groceries. So the how is just the route in which we take to get to where we need to be.
Yeah, I love that. It's starting with the end in mind, right? The North Star. I always come back to that North Star and then backtracking and reverse engineering how to get there. And like you said, you have a plan, you follow it, but it's going to change, right? You're going to have ups and downs. There's going to be hurdles, there's going to be barriers. You just got to navigate those, right? But as long as you have the North Star and the goal in mind, getting there is just part of the journey. And I think a lot of things that people don't recognize are you have to become somebody who loves the journey. If you really
Mhm.
want to get there and get to that place, you really have to love the journey and the ups and downs and the learning that comes along with the failures and things like that. Because they're going to be failures, right? You should just
Yeah.
accept that, right? But learn from them and enjoy the learning process and the bumps and bruises that come along the way, which is, like any good high level athlete does, right? Which kind of brings us to my next question now, right? You've worked with a lot of high level athletes at your clinic. Tell me a little bit about that experience. And was that a goal of yours right from the get go, or it just kind of happened and you've loved it and leaned into it? Tell us more about that journey.
So I think at first we have to identify how we view high level athletes, right? I think it's, for me, like, been blessed and fortunate enough to work with, top pro NFL players, top college guys, high school recruits, and even really badass parents, man. So I think the biggest thing for me when it's come to high level is how high are your goals and what are their priorities, right? If someone's coming in and they're a dad of three kids who play travel sport and he needs to be able to coach all of his girls and all of that stuff. He's a high level athlete in my priority, because at the end of the day, he's raising his children. He wants to be active. He wants to be an active role in their development. So to me, I prioritize that individuals just as much as I prioritize my, all pro cornerback in the NFL, right? Because at the end of the day, they are striving for something big and they need our help. So my approach is treating everyone the same. As long, if you give me 100% of your effort, I will give you 110% of my effort, right? So we match the energy that way. That's always been my approach, and I think what got me to this point is that approach exactly. Is that I treat everyone the same. Human body is a human body. A joint is a joint. It just varies in the degrees and intensity in which you need to be able to use those joint, right? So for example, like my top college guy who needs to perform well on the pro day, he needs to have good ankle mobility to, get a 4.3 on his 40 yards. But on the other hand, I have a dad who needs to be able to run across the street if his little son running all over the place and going to oncoming traffic, right? So to me, same thing. If anything, I would say the stake might be a little bit higher for the parents in that scenario,
Mhm.
right? So again, it's all varies. And because of that approach, I was able to just grow again from that point. So like parents would refer their friends, their teammates would start coming in. And the professional guy, same thing. We treat them extremely well, and we extreme meticulous when it comes to our approach to rehab, which is movement based and whole body approach, not just one joint, one pain point, and then that's it. Like if you have a knee pain, we look at your ankle, we look at your hip, we look at your history of your low back and all of that stuff, right? So just like in PT school, we're taught to rule in and rule out, and then seeing the whole kinetic chain up and down the neck all the way to the ankle. And because of that approach, people really enjoy working with us, because our job is to be able to play detective and then figure out, like, okay, hey, wow, like, yeah, my hips hurt, but I never realized that the ankle sprain I did 6 months ago, it's caused me to walk differently, and therefore I run differently. And now, rather than being able to get true hip flexion or hip extension when I'm trying to like sprint, I can't do that. So because of that, we're able to just kind of link everything together, put in like a good digestible presentation for them to understand what we're working towards, and then let them kind of dictate, like, hey, what are your goals? How are we going to figure this out? Okay, let's figure out like your long-term goal. All right, now three short-term goals. And then, okay, what's the first priority? We're going to have to get this angle moving first. Once the angle moved, then we can do this. Then we're going to do this next thing. And we're going to do this next thing. And next thing you know, boom, you have reached your goal. Now you're back on the pickleball court, right? Now you're back to playing pickup basketball. Now you're back to catching touchdown.
Yeah, I love that holistic approach that you take. And that leads me very well into my next question here. Like you said something real interesting there in that it's got to be digestible, right? So you are a physical therapist, you're a business owner, you're an author, you're an educator, right? You've got CEU courses, you do all the things, right? How do you go about educating your patients on your process and on what they have to do? Because I like the fact that you're looking more so at the outcome and trying to get the best possible outcome out of everybody, whether they're a dad who's, a Sunday weekend warrior type or a pro level, offensive lineman or something. You're just looking to get the best outcomes and you're breaking it down into digestible parts, right? So, how do you go about educating the patients and getting that buy-in and really showing people the digestible way that you're going to go about and approach this?
Yeah. So, my team and I, we stress on this a lot, which is our job's to listen. They're going to tell us everything that we need to know. If you just listen hard enough, you will understand like where the issues are. Like most of the time when we do our initial evaluation, we'll spend like 25 minutes, half an hour just asking questions, listening, see where they're at. And then from there, we meet them where they are. And then we then assess like, okay, here's the gap of where you want to be. Here's how we're going to get, and here's how we're going to close that gap each day. And here's how we're going to do it together. And here's how you're going to do it with our help. And here's how you're going to do it on your own. Right. So we get our patient to be an active participant when it comes to their whole body, their health, and their entire journey. Like my best analogy for this is like my job is I am either Gandalf or I am Alfred. They are either Frodo or Batman. And my job is to pick them up where they are when they're feeling down and they're feeling discomfort and they lost in confidence, they have a lot of fear. And then my job's like, okay, let's pick you up. Let's do this together, man. Let's walk through the finish line together. And then from there, that's how we build trust. Once we build trust, now we get to we peel off the top layer of the onions, and then we just keep going deeper and deeper to see like what's really a drive them, because the motivation is huge. Like I need to understand why you need to be able to work out. Okay, you need to be able to work out because you need to lose weight. Why do you need to lose weight? Why is that important to you? Oh, because I want to be here for my grandkids. Great. Okay, now we get to a core, right? So when you do have a roadblock or an obstacle, we can always go back like, hey, listen, like this might sucks right now because we're doing this. You might have a little bit of setback, but think about 10 years from now when you're picking up your granddaughter, right? And you're able to take her to Disney and you can walk the whole Magic Kingdom with no pain. How much would that mean to you?
Yeah, and you're not preaching physical therapy. You're not selling physical therapy. You're literally getting the results and the outcome and the transformation that they want, to bring it back full circle to the butterfly analogy. Like we can get you there. Oh, and by the way, I'm a physical therapist, right? I love that, I think we all need to get a little bit better at communicating that, right? Because I think physical therapy has a little bit of an identity issue, which I think can be used positively if we just let people know, hey, we're the answer to your problem, right? We're the solution. Oh, and by the way, we're physical therapists. Here's what physical therapists do, right? So it's kind of like you know, basically doing your part to spread the word of what physical therapy does and advocating for the profession, but in more of a solutions-based setting and solutions-based way
Mm.
instead of like, here's the profession and what it does, right? Like, no, we help people. We get people better, right? We solve problems. Oh, we just
Yeah,
happen to be physical therapists. So it's a
exactly.
nice
Like being
approach.
a physical therapist is a vehicle in which we help people, right? If someone have, financial goals to retire at, 60s, right? You want to do that by hiring the right financial advisor, right? At the end of the day, we're in a service profession, which is to serve and to help people. And then we happen to do that through the means of physical therapy.
Yeah, I love it. So what would you give as far as advice to, let's say, a new grad or somebody who's been out 3 to 5 years, as far as like either and or when do you know that it's time to like go out and do your own thing and step out and start a business, right? And what advice would you give if somebody was looking to do that, whether it was 1 year out or 5 years out?
I think you have to reflect on this a lot because the timing is different for everybody.
Hmm.
Um, I did I did in 18 months, but I did it out of a necessity
Yeah,
for for my own like mental health and well-being and everything else. Because if I kept going down that path and I just played it out in my head, I was like, I'm gonna leave the field in 3 years, and I don't want that. I was like, so if I'm gonna leave the field in 3 years, what's the worst thing that could happen? I was like, well, the worst thing that could happen is that I start this thing, it doesn't work, and I'll end up with the same
yeah,
solution, which is leave the field in 3 years. Just like I tell my patient all the time, if right now what's on the table is surgery, I was like, what if we do everything else before surgery? And then we come back to surgery because surgery is on the table, right? So the the timing in which you started, it has to be um, how much are you willing to sacrifice?
yeah,
Because when you start a business or when you start on any new venture, it's going to require a lot of time. I mean, I have the best wife where she's been supportive of me since day one. And we probably didn't see each other on Saturday for like 2 years, just because I was working every Saturday. Right? We see each other, but like half the day is gone.
yeah,
Right. So that's come with the sacrifice. So understand that there's a lot of input that you have to put in, and that input is willing on how much you can tolerate. And if you can tolerate that, um, then you can say, okay, I'm willing to give this up. I'm willing to give up my Sunday brunch. I'm willing to give up, you know, going out. I'm willing to give up seeing family for a little bit for the holidays because I need to get this done. Then you say, okay, then you're ready, right? Because and you and I have been in this field for a long time where you see things of people who have great success, but somehow they make it look extremely easy. Um, and they don't see like that favorite saying is like overnight success takes 10 years,
yeah.
right? And that's the whole thing. So you have to look at your situation. Like, is the pain bad enough for you to make a change? Or if it's not that bad, then you don't have to take a change yet. Or you don't have to go all in and burn the boat. You can start it part-time, side hustle it, right? But then you got to understand that you're giving up a lot of time on the side to do that as well.
Yeah,
And
yeah.
last thing is you have to be comfortable enough to put yourself out there in order to help the people that you want to help. Because if people don't know that you exist, then you can't help anyone.
Yeah, you can be the best physical therapist in the world, but if people don't know who you are, where you are, and what services you offer, nobody's coming to see you. So
Exactly.
you got to be the biggest proponent of yourself. And I tell my students all the time that, you've got to literally shout it from the rooftops. Like, blatant self-promotion is totally fine. It's almost a disservice if you don't do it because you have
Mhm.
the tools to help people and you should be out there helping as many as you can,
Yeah.
So, well, Natty,
Oh, real quick, sorry.
yeah, go
Last thing.
ahead.
Before you even considering start, it's like you also need to have proof of concept and proof of success, right? You have to have a track record that you're actually a great therapist, you can get good outcomes. And I think that will speak a lot of volume. If you're just coming out and you haven't proved anything to the marketplace yet, then it's going to be really hard for you.
Yeah, I think that's two huge points there, right? One, you've got to be comfortable with your skill set. And if you are truly, honest with yourself, if you're not that good yet, do what you got to do to get those skills up, right? Take CEU courses, take certifications, do what you got to do till you feel comfortable and know, yeah, this will fly. Like I got the skill sets I need to take it, right? And then in order to get to that point of like success, whatever you define that as, I think people need to realize the amount of sacrifice that goes into it. And it's not just money, right? It's time. It's time away from family, like you were saying. It's mental fatigue and pressure and, Are you willing to push that? And if you want a 7-figure or an 8-figure business, those are much bigger sacrifices, right? So are you willing to make those? You have to know your own level of sacrifice and write down all the true sacrifices that are going to happen in order to make this a success and stick with it and see it through. So really good points there. Well, Natty, we ask all of our guests this one final question. And that question is, if you could change one aspect of higher education, whether it be DPT or otherwise, what aspect would you change and how would you change it?
I would change it by making us a test subject and a role model for ourselves first, because for us to lead the forefront of healthcare, we have to look like we are an example of healthcare, right? So, and it's okay if you're on a journey, but make sure you're on a journey,
Yeah.
right? I think that's the biggest thing, because you don't have to be deadlifting 500 pounds. You don't have to be doing all these things, but as long as you understand, you say, hey, I'm a human. I'm working on myself. And if you work with me, we can work on that together. I think that's a huge thing. Every time we take on PT student or every time I go give a guest lecture, my main thing is like, you got to understand what your patient are going through. Do not prescribe exercises that you have not done it yourself or programming that you have not done it yourself, right? And then that's how you start becoming your own walking billboard, right? You want to walk in. Listen, if I go see my cardiologist and he's smoking through cigarette on the parking lot, it's really hard for me to trust him.
Yeah. No, I'm guilty of that myself, right? I'm on my own journey. I did home health for many, many years and I drove around and I ate, gas station food and I stayed up late at night documenting. I was in rough shape, right? And so fortunately and unfortunately, COVID was a hard reset for me. And that was the first time I was actually able to take a look at myself and be like, all right, something's got to change because I'm not going to make it. I'm heading for a heart attack here. And luckily, it's been great. It's been the best journey of my life so far, and I'm still a work in progress, but I'm actually enjoying it for the first time ever. So, trying to walk the walk and talk the talk. It's
Exactly.
it's been good for me though. It's been a really good introspective type journey, one that I needed, and I knew I needed for a long time. But again, the pain wasn't bad enough to really have to focus on it and make sure that it counted. Then you get 2 kids and you start, they age, and all of a sudden you're like, oh wow, life's happening really fast. I better do something about this. So
Mhm.
yeah, no, I appreciate that, man. That's a great take. Well, Natty, where can people find you, reach out to you if they have further follow-up questions or want to learn about the book or the CU courses or anything like that? Where can they find you?
Yeah, so you can follow me on Instagram, Dr. DOCTOR.NATTY. You can follow my clinic at Myokinetics, MYOKINETIX. Thank you for reminding me. We do have a new book coming out. Is The Complete Guide to UCL Rehab. This is my 4th book.
Man,
Yeah, it's pretty
crushing
crazy.
it, man.
So yeah, so I wrote one 2 years ago, The Complete Guide to ACL Rehab, which we gave it to coaches, parents, athletes to understand like how to just go from point A to point B, to point Z when
Yeah.
it comes to ACL tear. And just because another statistic that's great to know is, only 25% of kids who underwent ACL, reconstruction will actually return to their prior level of performance on the field. So that's one of the main reasons why I wrote that book. And then the second reason why I wrote the book for the UCL book is only there's 15% chance of kids never returning to the mount again after UCL reconstruction.
Mm,
And my goal for that is just to empower people, whether it's parents, athlete, coaches, or a PT student themselves, future PTs, other physical therapists. It's for us collectively, we can change that statistic
yeah.
and bring it a lot lower.
Yeah, for sure.
And
I mean, that starts way earlier, right? We got to get them on a little bit more of a regimen, I think, and not overdo it. But then B,
yep.
you see it on the pro level too. After a UCL reconstruction, they get better sometimes. So like it
Hmm.
can be done, you know? So
Yeah.
I love that take,
So,
man.
yep. Find me on Instagram, and then you can find the book on Amazon.
Awesome. We'll drop all those links in the show notes so you're easy to find. Dr. Natty Bandasak, folks, thank you so much, man. It's been a pleasure.
My pleasure, Scott. Thank you so much.